Okay, so today we shall be discussing about appendicitis. It is inflammation of the appendix, as word indicates. So it is inflammation. So patient presents with the pain in right lower quadrant. So before moving towards appendicitis, let us look at the normal distribution of abdomen. It is divided by imaginary line into a vertical and one horizontal line. So it is divided into four quadrant. Number one, it on right side upper quadrant, right upper quadrant, right lower quadrant, left upper quadrant, and left lower quadrant. So abdomen is divided into these four quadrants by imaginary lines. Now appendix is present in right lower quadrant. So in appendicitis, patient presents with pain in right lower quadrant. Our patient will exhibit pointing sign, as you can see in this picture. That patient or this female is pointing the pain here, so that is known as pointing sign. Now appendicitis is acute inflammation of the appendix, and patient presents with the pain in right lower quadrant at McBurney's point. McBurney's point is the point. It is one third of the distance from right anterior superior iliac spine to the umbilicus. So patient will complain that patient will point toward the McBurney point, and he will complain that I have pain in right lower quadrant. So that is appendicitis. And causes of appendicitis, there are different causes, like it is related to the blockage of inside of the appendix known as lumen. When lumen of appendix is blocked, appendicitis is developed. Blockage leads to increased pressure that leads to impaired blood flow and inflammation of the appendix occurs. Acute pain will be present. If it is not treated, there will be gangrenous rupture of appendix, and patient will present with tearing up ruptured appendix, and that is emergency, medical emergency. And bacterial causes are also there. Viral infections can cause appendicitis in digestive tract, leads to swelling of lymph node. When lymph nodes are swollen, squeeze of appendix and causing obstruction of the lumen of the appendix, that leads to appendicitis. And swelling of appendix is known as lymphoid hyperplasia, and that condition creates appendicitis. So appendicitis is acute inflammation. Patient will have central abdominal pain in right iliac fossa or right lower quadrant. Patient will present with nausea, vomiting, anorexia, low-grade fever, pyrexia, localized tenderness in right iliac fossa. Pointing sign will be positive in the patient of appendicitis. Right iliac fossa, peritonism, percussion tenderness is a kind of sign. Peritonism that rebounds when we perform percussion in the right lower quadrant. Patient will feel pain. Rebound tenderness will be there when we touch the right lower quadrant or right iliac fossa. Patient's facial expression will show that patient is feeling pain, or there is Rosing's sign. It is a sign or pain in right iliac fossa is felt on palpation of the left iliac fossa. Let's suppose this is abdomen. It is divided into four quadrant. Appendix pain is present in right lower quadrant or right iliac fossa. So when we perform examination of left lower quadrant, so patient will feel pain. When we palpate the left lower quadrant, patient will feel pain in right lower quadrant, right side. So that is known as Rosing's sign. It is present in appendicitis. Now, also patient will complain of migratory pain, Rosing sign positive, anorexia, nausea, vomiting. Signs will be patient will have tenderness in right lower quadrant, rebound pain, elevated temperature. Patient will have fever, pyrexia, and labs shows leukocytosis and shifting to the left. That is the pain, or anorexia, nausea, vomiting, tenderness, rebound tenderness, fever, leukocytosis. So these are present positive in patient of appendicitis. Now secondary signs will be inflamed fat, free fluid collection, localized generalized paralytic ileus, and elevated C-reactive protein are present in appendicitis. So, by these clinical symptoms, we diagnose appendicitis and treat the patient accordingly. Patient will complain of nausea, vomiting, diarrhea, constipation, loss of appetite, low-grade fever, swelling in the abdomen, pain in around navel or around umbilicus, and these are the clinical features. Rosing sign will be positive. So how we manage the patient of appendicitis? We perform surgery in the case of acute appendicitis because it is medical emergency, or in order to correct or prevent fluid and electrolyte imbalance. We rehydrate the patient and give him antibiotics. IV fluids will be administered and surgery is performed. Analgesics for pain are administered, like morphine sulfate. Antibiotics are given to the patient like cefotaxime and levofloxacin and metronidazole should be given to the patient in order to prevent bacterial infections. Antibiotics will be given, drain the pus if there is pus, remove the infected material, replace the fluid, like give normal saline. Blood testing will be there, imaging will be there, and should be performed in order to correct any kind of dysfunction. So appendicitis is treated according to this. So we discussed appendicitis. In appendicitis, inflammation of appendix occurs in right lower quadrant, and patient present with pain, rebound tenderness, losing sign positive, and the patient will also have nausea, vomiting, anorexia, and fever. And appendix is present in right lower quadrant. Inflammation of the appendix present with the Rosen sign positive, and right lower quadrant pain. McBurney's pointing sign will be positive in the appendicitis. So that was today's topic. In next video we shall discuss another topic. Stay safe, stay happy. Thank you.